All right. Hey, everybody. We're doing our second little episode here with, this is Dr. Greene. I'm Lisa White, and we're calling these clinical conversations. And today's topic, kind of our first big topic we're kind of addressing.
But maybe one of the most common questions that comes up.
Yeah, I asked Dr. Greene, I said, what are some common questions that a lot of your patients ask you? We should probably start off with something like that. And the question you posed was,
why am I not getting pregnant? And this is by far the most common question people ask. And it usually makes them kind of surprised when I tell them that's not really a relevant question. You know, instead what I try to do is I encourage people to think about what do they need to do in order to successfully achieve a pregnancy. And what I mean by that is it's common in healthcare that we're trained to be problem solvers. If people are having an allergic reaction or a pain or a fever, we try to figure out what's causing that problem and target our treatment towards that one cause. But the reality is for most people that are dealing with fertility issues, there's not one problem. It's more like several things that are more minor that are all contributing to the greater challenge. And I think it really changes people's perspective. I'll give you a great example. A very fertile 30-year-old woman with a very fertile partner trying to get pregnant on 1 month, on average has about a 20% chance of becoming pregnant.
20%, not very much.
No, and then once they're pregnant, there's almost like about a 15% risk of miscarriage. Now, the reason for that is not every egg's a good egg. And on some months, it's a good egg, but it meets up with a bad sperm. Or the reality is it might be a good egg and a good sperm, but bad timing. Or maybe it's a good egg and a good sperm and good timing, but a problem with implantation. So in a natural cycle, several things have to go right. But that's why people just try several months in a row, and usually most people are successful. If someone isn't getting successful within a certain period of time, that's what we define as infertility. Now, occasionally it's one obvious problem. She's got blocked tubes and the egg and sperm can't get together, or he has no sperm. Those are pretty rare situations. Most commonly, it's more a little of this and a little of that and a little of something else. But when people come in and say, how come I haven't gotten pregnant over the last 12 months? Well, probably for some months it was this reason, and some months it was that reason, and some months it was something else. So if instead people don't ask that question and say, what do I need to do to achieve my ideal family? It creates a more forward-leaning goal. Because if someone wants to have 2 or 3 children and they're 39 years old, you got to plan that second pregnancy at the same time you're planning the first one. Or by the time they deliver that first baby, they might not be able to achieve another second pregnancy. So, you know, what we tend to do is try to get people to refocus. And instead of saying, why am I not getting pregnant? What does the ideal family look like? And once you answer that question, we can look at the different variables that impact your ability to achieve a successful pregnancy and talk about treatment options that usually involve controlling some variables or more variables or as many as science allows us to. And the more variables we're influencing, the higher the chance and the more predictable the outcomes.
And do you find a lot of people have tried, I don't know, how they've been trying for months and months, years when they come see you? What is your...
Well, it depends. You know, most commonly if someone, you know, again, most fertility problems are diagnosed with a calendar. If someone is less than 35 and has not used contraception for 12 months, we say that they meet the definition of infertility, even if you don't know what the cause is. If someone's over 35, it's recommended they get evaluated in at least 6 months. To be honest with you, I think it's a good idea for women at any age over 30 to at least get very baseline ovarian reserve testing, especially if they want to have more than one child, because that testing can establish a baseline for now and then also be a point of comparison over time. So again, it's reshaping the question of what do you want your ideal family to look like that should then guide your testing.
And I was going to ask you about testing, if you could touch upon that. That might be you know, I don't know if you can answer that succinctly, but some basic tests that women should consider or, you know, do when they're starting out in this process and they're struggling. Why am I not getting pregnant? And what tests would you
Absolutely.
recommend?
Well, when somebody defines that they want to achieve a pregnancy or 3 pregnancies, there's 4 variables that we really need to look at.
Okay.
One is ovarian health. That's kind of, you know, answering how fertile do we believe she is, looking at her ovarian reserve, trying to estimate egg quality based on age, medical history, general health history. So ovarian health is one category. Okay. Second category is sperm health. Most men have absolutely no symptoms, and at least 30 to 40% of the time there is a contributing male factor. So you got to look at sperm health. 30 to 40%.
Yeah, and a lot of people don't take into account how.
Well, and guys don't have any clues because we don't have menstrual cycles. Right. We don't get menstrual pain. Yeah. It doesn't affect a guy's libido. It doesn't affect his skin or anything like that. So you got to look under the microscope. Okay. So ovarian health, sperm health, and then basically the third is uterine health and tubal health. Okay. So in other words, does a woman's uterus look like a place that could, you know, embrace and sustain a pregnancy? And are the tubes open? Those 4 variables are what you need to focus on. Okay. And what's important,
good tips for everybody.
Well, and what's important is if you instead try to focus too much on what is not working, you end up ordering a lot of tests that don't get you any closer to your goal. Right. And the point is, most people would rather have a baby than a reason for why they weren't getting pregnant. So before anyone orders any test, I always say you should ask yourself, how is this going to change what I'm going to do? And if it's not going to change that you should do that or not consider this or do that, then it's a wasted effort. Because all you're trying to do is answer a question that may not even be relevant.
And then you guide couples or individuals down the path of recommended tests based
minimal
on
amounts of tests, but then focusing on what their goal is. Do they want to have 3 kids? Do they want to have 1 child and they want that to be blank and you can fill in male versus female? Or, you know, is it like one and done and they just want a healthy child? You know, if someone...
Do you get people say, I really want a boy, or I really want a
Oh, absolutely. We call that family balance, and that's probably a whole other topic.
Yeah, that's another whole other topic.
Another day.
Wow, for in our situation, I was like, I just want a healthy baby.
Yeah,
you know?
no, like, it's fairly common that people want to talk about family balance, so stay tuned. We can talk about that too.
Yes. Well, thank you for joining us for today's conversation, and anything else? I think this was great.
Have a great day.
Bye.